Ladies and gentlemen, I have the high honor and a great pleasure to bring to you the President of the American Public Health Association, Dr. Adewale Troutman.
Good afternoon. I am so pumped to be here this afternoon after a year of working as your president. And after that brilliant speech, it's often people say, it's hard to follow some people. That's a tough act to follow, but I'm sure that I will do my best. Before I start, I want to say that it was definitely my beard that helped the Red Sox win the World Series here in Boston. And as we know, APHA, we've said this already, brings good luck to any city. You remember we were in San Francisco last year. And we want to point out again, World Series in 2 years in Chicago. So we want the Cubs fans to know that we're coming to help you. But seriously, I want to acknowledge the honor bestowed on me by this great organization to be president and say some thank yous. And my notes are out of order. First, I want to thank Donna Peterson, University of South Florida Dean, who so diligently recruited me to the best public health college in the university 3 years ago, and now so graciously supported me in the presidency this year. If Donna's here, I just want to make sure she knows I appreciate her so much. And most recently, I've just been appointed as Associate Dean for Health Equity and Community Engagement at the University of South Florida. Now, I also have a recruiting goal of 200 new public health students to USF, so I'm being very shameless about this plug. There must be at least 200 of you in this room that would be perfect for the amazing public health programs at USF. Sunny Florida, come on down. I also want to thank my family, starting with my professional and personal life partner, Denise Vasquez Troutman, who has continued to run our consulting company, the Troutman Group, while keeping me together this year through sickness and health, in good times and bad. And she's sitting right over here, and I love you so much. I want to shout out to my daughter, Anasa, who was with me last year when I won the presidency in California, but is touring, if any of you have heard of this individual, with India RE this year. Thanks to my other daughter, Nandi, who got her doctorate in public health from Georgia Southern this year and is now the best professor at Armstrong University in Savannah, Georgia. The son I never had, her husband, Randall, and my grandson, Nasir Ade, love that middle name, is also here. Denise's children, Laura and Raphael, who are not in attendance but who are here in spirit, have always supported me. Unfortunately, my niece, who is here at Berklee School of Music, master musician, couldn't make it today, but I wanted to make sure I mentioned her name, but she's here right down the street. And what's a thank you without your mother? My mother, who is 95, doesn't fully grasp the gravity of this presidency, but every time I call her on the plane before they tell me to shut the door, before they tell me to shut my phone off, she tells me, "Love you, son." I want to spend a special note of thanks to our soon-to-be president, Joyce Galpin, for traveling to affiliate meetings when I was unable. Joyce, where are you? Thank you. And lastly, to my APHA family, Georges, Ida, Werner, Regina, and staff who coordinated every appearance and was so supportive every step of the way. Most of all, you, who trusted me to take the APHA agenda to almost 15 cities and around the globe, to 3 international destinations as the face of public health leadership. So as I reflect on this year, it's been a year of high expectations and a year of significant health challenges. My first travel was to Hawaii with Gerald Ota as our host. I mean, what a beautiful state. And a former APHA board member, Miley, who so passionately explained the inequities in health status and cultural challenges of the native Hawaiian populations. Very eye-opening. 2 months later, I was off to Asia. I led a delegation to Taiwan to see universal coverage in action where virtually the entire population has coverage and carries a smart card for efficient access of vital information. It can, in fact, be done. Blew my mind. Unfortunately, soon after my return, I was hospitalized with a septic knee and needed surgery for a replacement. A few months after that, tremors started in my hand, and I was diagnosed with early-stage Parkinson's disease. Medical challenges I could have never expected. But it was my passion for the organization and the message so dear to my heart that kept me going. After a few months of recovery, I was off again. About 10 other states in total, from Southern California to Montana to Washington State to Canada, then off to Africa to speak at the collaborative meeting of the Public Health Association of South Africa and the new African Federation of Public Health Associations, to representatives from 27 African countries carrying our message of health equity, social justice, and the right to health and health care. They spoke of public health leadership needs and pipelining. Everywhere I went, I spoke of my upbringing in the South Bronx, my early years in community college, my .38 index in my first semester, .38, not 3.8. It's true. Practicing emergency medicine, running health departments, and now academia. This poor kid from the Bronx could have let my zip code determine my life expectancy. My level of education determined my health. My environment determined my occupation and my place on the social gradient. Social determinants were not a theory for me, but my reality. At each appearance, it was important for me to show how we are all connected. From SARS to tsunamis, from the economy to war, we are our brothers and sisters' keepers. We are all truly connected. It was Martin Luther King who said, of all the injustices in health are the most shocking and inhumane. With that in mind, as you know, APHA has had 3 pillars of focus this year. 1, achieving health equity. We stand firm on the principles of the right to health, social justice, and the elimination of all forms of oppression and exclusion. Number 2, assuring the right to health and health care. Our organizational beliefs, if lived up to, requires a certain understanding of the inequities that drive hunger, poor health, and early death. Injustice is at the base of that. Injustice is insidious. It twists its way into the fabric of society and chokes the very lifeblood of primary victims, which is, in fact, all of us. We're all familiar with the dictum, injustice anywhere threatens justice everywhere, making it clear that we must all be involved in its end. Number 3, the rebuilding of the public health infrastructure. I stand on the shoulders of so many who have gone before, those with true power and determination. Who stands on your shoulders? Who will stand on your shoulders next? The notion of the power of one lives in all of us. We can change the world. Malcolm X did it. Martin Luther King did it. Steve Jobs did it. Harvey Milk did it. Barack Obama is doing it. Barack Obama is doing it. Claude Jacobs in Cambridge and BCHW is doing it. Sewanee Jet in Florida affiliate is doing it. Washington State is doing it. We all have the power of one, and if we come together and create a movement similar to the movements of civil rights and women's rights, we can make a difference in health and make health equity a reality. Movements take collective consciousness, vision, determination, and risk. Thank you. We recognize this, in fact, does take a movement, and a movement based upon health equity, the right to health, and most importantly, a stand for social justice. Turn to your neighbor now, let's do a little church thing, and say to your neighbor, I am the movement. Like you mean it, I am the movement. I turned to your other neighbor and said, the movement is now. So I want you to go back to your organizations and your communities, recruit others to join this movement and work with this organization. Let us stand shoulder to shoulder in this work. And as I wrap up and take my seat, my message to you is to take a stand for something. Do something. Do anything. Consider yourself a leader who can be that difference. I don't want you just to push the envelope. I want you to tear it up. All the risks that I've taken in my life were based on what was best for my people, myself, my children, my fellow man. Life is about taking risk. I read this all over the world, and I wanted to share this with you before I sit down. What better message than my last to share it with you this time? To laugh is to risk appearing a fool. To weep is to risk appearing sentimental. To reach out to another is to risk involvement. To expose your feelings is to risk exposing yourself. To place your ideas, your dreams before the crowd is to risk their loss. To love is to risk not being loved in return. To live is to risk dying. To hope is to risk despair. To try is to risk failure, but risks must be taken because the greatest hazard in life is to risk nothing. The person who risks nothing, has nothing, does nothing, and is nothing. He may avoid suffering and sorrow, but he simply can't learn, feel, change, grow, love, or live. Chained by his certitude, he is a slave. He has forfeited his freedom. Only a person who risks is free. I invite you to be free, be the movement, stand shoulder to shoulder, bring about health equity and social justice today. Thank you very much. Thank you. I guess I'm done. Thank you.